Hey guys, welcome back to the Odie Survives channel. My name is Odie and today I'm back with a new video, bringing you with me to my CT scan. Yes, it's that time where I have to get scans and I figured why not bring my peeps with me? Come on over. I'm not sure how much I'll be able to record, but I figured we can use this opportunity as a teachable moment. I want to show you what it's like to get a CT scan. Let's go. Vámonos. All right, guys, for those of you who are not familiar, this right here is barium solution. And when you're going to have a CT scan, it is important for you to drink this about 90 minutes prior to your exam. And the purpose behind drinking this solution right here is basically it coats your esophagus, your stomach, your intestines, and it provides a better image. It creates what they call a contrast, so we're able to identify if there's, any lurking tumors. And today I'm going to be drinking 1.5 of these bottles. They're having me drink it within a 30-minute time span, and basically this is a tropical fruit flavor. Not so bad. I've had others that are kind of like a creamier consistency, and oh my goodness, those don't suit me well. So I definitely prefer this, and it's basically clear in color, but it does taste kind of tropical, if you will. So I'm gonna go ahead and have this right now. I need to have, like I said, 1.5 of these. Cheers! Let's go. You know what it tastes like, guys? It's actually not that bad. It tastes like flat Sprite, like Sprite that is no longer carbonated because you left the can open or something like that. That's pretty much what this tastes like. But don't be fooled, because this stuff right here, once it goes in my system, it kind of lingers around for 2 to 3 days, and it gives me
runs. It really does. So
it's so important for you to drink a bunch of water once you're done with your CT scan, just to make sure you filter this out of your system. You don't want any solution lingering around, trust me. I know from experience. I've had my share of CT scans at this point, probably, I don't know, I mean, I would have to count, but probably like close to 15 or 20 in the 2 years that I've been battling cancer. So call me an experienced barium drinker, I guess. Final stretch. Finito! We are done. Now we're gonna play a session of Flip Cup. Yeah! Done! Alright guys, now that I am done drinking my barium, I have to wait about 60 minutes to make sure that solution kind of travels through my intestines and provides the best image as possible. And I guess I'll use this platform right now to kind of give you guys a health update. For those of you who are new to my channel, hi and welcome. Happy to have you here. Thank you for joining us. Basically, I was diagnosed with metastatic colon cancer in 2019. That cancer had metastasized to my ovaries, to my peritoneal lining, to my liver, and I had 2 tiny spots in my lungs. But we never found out if those were cancer or not because we weren't able to biopsy them, 1, and 2, they've never shown up on any scan. So hallelujah, praise the Lord for that. But anyway, in 2019, like I said, I was diagnosed with metastatic colon cancer. Post diagnosis, I endured 12 rounds of chemotherapy. I also had 4 major surgeries. Those surgeries included a liver resection, HIPEC surgery, if you're not familiar. Basically what it is like they inject you with piping hot chemo. It's hypothermic chemotherapy. Additionally, I've had an oophorectomy. I've had a full hysterectomy. I mean, I just had countless surgeries to kind of debulk and remove my cancer. Following that, I actually went into what they call an NED, or no evidence of disease status, and I was cancer free for about 6 months, but unfortunately I did have a recurrence in January of 2021. So January of this year, we discovered that my cancer had returned, and this time it is back in my lymphatic system, the back part of my peritoneal or my abdominal lining. I have 5 compromised lymph nodes. When I was re-diagnosed, each tumor was about 2 centimeters or 2.5 centimeters in size. But after 4 more rounds of chemotherapy of FOLFIRI, we found through scans that this chemo regimen is indeed working, because there was shrinkage in each of the lymph nodes, and they had all reduced in size by 0.5 centimeters. My oncologist at that point said, okay, this is not the time to stop chemo. This is actually the time to continue with your chemo regimen, because the point is to eradicate the disease, to eliminate the disease. Currently, I'm not necessarily operable. I've had 3 opinions, and all 3 of my surgeons feel that it is too risky to go in because of the positioning of where these lymph nodes are. Basically, they have to bypass vital organs, and that's just too much of a risk. So right now the plan is just to continue on with chemotherapy. And so I've had an additional 4 rounds. So I've had 8 rounds of FOLFIRI on this line of treatment, which means it's time for scans. And that's why I'm here today. That's why I am scheduled for this CT scan. Hopefully, fingers crossed and praying to God that, you know, this scan will reveal more shrinkage, and hopefully, you know, the scan will allow us the space to plan for what life post-cancer will be like for me. So whether that is maintenance chemo or some other drug or immunotherapy, or something to just keep me on an NED or no evidence of disease, aka cancer free. I mean, I'm a realist, and I understand like chemo can stop working at any minute. My body can create an intolerance and cancer can continue to spread, but I just choose not to put that out in the universe. I choose not to really dwell on that or think about that too much, because there's no use. So I decide, and I actively make a decision every single day to kind of put it out there and to manifest that this chemotherapy is working, that there will be a light at the end of the tunnel, that I will see an end to this, and that at some point I will have the privilege of getting back on maintenance chemo versus, you know, active treatment every 2 weeks, which is harsh on the body. Anyway, guys, I'm gonna go ahead and hang out, enjoy this scenery here, and I'll catch up with you guys in a little bit. Here, this is the CT scan machine, and this is the bed that I'll be laying. All right, guys, I'm pretty much done with the procedure. At this point, all that's left is to drink lots and lots and lots of water. I want to make sure I get this barium out of my system as quickly as possible, filter it through my kidneys. Goodbye, bye-bye, get out of me. The procedure only lasted about 20 minutes. Basically, you lay on the bed. I'm gonna go ahead and insert a picture right here of me. They then go in and they access your vein, because like I said, you will get some of that solution intravenous as well to hide in the images. Then they pretty much put you in there, and it's like a Disney ride, in and out, in and out. It's pretty quick. For some intervals, you have to kind of hold your breath kind of like this for a couple of seconds. The machine is actually pretty cool. It has a speaker, so the tech who is recording the images or taking the images can actually speak to you, and so he comes on the speaker and kind of tells you when you need to hold your breath and when you can breathe normally. And I mean, it's a pretty simple procedure. There's really not much to it. Now all that's left is a term that has been coined by the cancer community lately called scan-anxiety, okay? And it's basically the anxiety produced from having these scans, because at the end of the day, you never know what's on the other side of that scan. Like I said earlier, I am hopeful that this scan will give us favorable news, that this scan will give me the light at the end of the tunnel that I've been hoping for. I know that this is not gonna be the end of treatment for me. I think my doctor will probably have me finish out 12 rounds of this line of treatment, which, like I said earlier, I've done 8, so 8 down. How many more to go? 4 more to go, hopefully. I mean, I don't know. We never know what's on the other side of that scan, so we'll just have to see. We'll keep hopeful, keep positive. If you guys are out there, if you're believers, please pray for me. Send me positive juju, good spirits. I read your comments. So thank you so much, amigos. I'm gonna go ahead and chug this water and then have some more water and some more water. So I'm just recording this. I don't know if I'm gonna post it or not, but I'm sitting here and I'm having lunch and I open my CT scan results, and although the disease is not completely gone, we're stable, and stable is good, because stable means that the chemo is working and the cancer is controlled. So I feel relief. I feel grateful for the medication that is sustaining my life. Now, I opened those results without even talking to my doctor. I don't know what he wants to say or what he wants to do next or anything, but for right now, I feel relieved. I feel good. And we know from my interpretation and from what I'm reading, and after 2 years of having metastatic disease, I think I sort of understand the jargon a little bit better than before. It seems to me, from my interpretation, which may not even be valid, but it seems like the disease is stable. So alright guys, so it is exactly 10 days after my CT scan, and I am currently sitting in my doctor's office to hear the results. Now, as you guys saw on the previous clip, I did kind of take a peek and I read the results on my own terms, because they were available on a platform that patients use. It's called My Chart. At least that's what my cancer center, Sylvester Comprehensive Center, University of Miami, uses. And after 5 days of the results not being opened, they will release onto your chart. So blessing or a curse, I don't know. I went ahead and read the results, and like I mentioned earlier in the last clip, that's based on my interpretation. I interpreted the findings as something positive. I'm not sure what my oncologist is going to say. I'm not sure how he's gonna want to operate moving forward. Regardless of that, I just want to talk about the immense amount of anxiety that I feel at the moment right now. I thought I was good until I entered this facility, and I could feel, seriously, my heart is gonna come out of my chest. I'm kind of teary-eyed, if you notice. I'm just nervous because this journey for me has been like Pandora's box. So I never know what's gonna come out of it. I never know if they're gonna give me positive news, if it's gonna be more challenging news. Regardless, I know that I'm gonna have to move forward with it, but it's just an unpleasant feeling overall. Anyway, I plan to keep you guys posted on what my oncologist has to say, and sucks. All of it sucks. All of it is hard. I just want this damn disease to leave me alone. I know I'm having a moment right now, and I know like overall I never really feel this way. It's just a compilation of like just being nervous for the past 10 days. Scare anxiety is a real thing, and whoever wants to tell you it's not can just disappear, because it is a thing. And yes, it's mentally challenging to just have so much anticipation for so many days, and I don't care how much distraction you participate in, it's always in the back of your head. And the reason why it's always in the back of my head is not because I'm fixated on death. I'm fixated on the fact that I need to survive for my kids. I feel a complete obligation to live for them, and it sucks that this disease wants to come and be in the way. The anticipation has kind of caught up with me, like, oh my gosh, more chemo, talking to my oncologist, not, like, not knowing what the future holds, all of that, it's part of the process. And, I don't mean to come on here and cry and be negative every time, but I do have full and complete intentions of being honest and being real, and this is part of it. You know what? It's not all rainbows and butterflies. Cancer is not always that glorified image of like a brave, strong person. No, you know what? We're hella real humans on the other side of this disease. We feel, right? We have emotions, and sometimes they get the best of you, and that's just part of the process. And to the gentleman in my last video who said, you could stop with the blah, 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 blah. You know what? No. Blah, blah, blahing is a coping mechanism for me. I will continue to talk, and I will continue to be an advocate for this disease, because you know what? Nobody, I don't care how old, how young, I don't care how well, how successful, how financially stable you may be, this disease does not discriminate. It just does not, okay? There's no discrimination. You do not impose this on yourself. You do not create this. No, this just happens. It is your cells mutating in a bad way, and there's no way to stop this train, okay?